So, muna ni siya guys, ang management is sa 7th kay mag-start na ta og uterine exploration of the uterine cavity. Then uterine packing na ta mong ginabuhat sa sa mga clerk nga mag-packing sila with gauze to eliminate sa mga blood clots na were trained, and uterine artery ligation through laparotomy. So, i-cauterize na to ang bleeding vessels. Then lastly is hysterectomy na jud, is tangtangon ang uterus, which causes no menstruation and because uterus is the organ of menstruation. Matujud na siya itong limanan, guys. So, lastly is lacerations. Hindi pa siya last, guys. Small tears or cuts in the perineal tissue, vaginal side, or cervix. This causes insufficient episiotomy, lithotomy position, and macrosomia. So, small tears or cuts in the perineal tissue inside of blood vessels. So, manifestation niya, guys, kay there will be bleeding continuous in a steady trickle, bright red in color. So, malacerated na siya, na tears sa ihang perineal tissue, vaginal side, or cervix. So, the fundus is firm, ani. Classifications of perineal lacerations. Bawal unta mag-fundal push because mapil ang cervix o gisi. Yes, so muna siya ang perineal laceration. Second degree, apil ang vagina, perineal skin, elevator ani muscles, and perineal body. So, lacerations. Surgical repair, difficult to tahi because vagina is erogated. That's why. So, what is the management for lacerations? And what are the risk factors of lacerations? So, inadequate episiotomy, macrosomia, and the traumatic delivery. So, the use of forceps and vacuum can cause laceration. So, that is why laceration is kanang magisi vital ang vagina. So, how do we manage it? So, according to the notes, we are going to avoid enema for the 3rd and 4th degree. So, difficult na ni siya itahi kay ang vagina is erogated, no? Dili siya straight ba? So, kailangan putag episiotomy and straight assist. Okay. Increase ang fiber intake. So, avoid na to ang constipation. Unsa na lang man natong buhaton. So, mag-increase tag fiber intake sa laceration. So, we also have assist. So, straight lighting. Okay. Ang pasabot ani sa assist straight lighting. Kay, unsay buhaton sa para paglan. So, ang assist nato ani kay mag-draw siya light towards the vagina para dili bitaw siya ngit-ngit nga magtahi. Kay bisag masin apil niya ang rectum og tahi. So, kailangan nato siya ipalight. So, mao na siya, guys. So, unsa toy way sa ato ang pag-manage sa laceration is avoid tag is it English aspiration. Yeah, avoid tag aspiration kay mag-increase na lang ta og fiber, and also avoid ta og enema. Avoid tag enema, of course. Mag-lacerated na gani ka, enema pa jud ka sa 3rd and 4th degree nga laceration. Mag-episiotomy na lang ta. Kay mag-episiotomy kay gisit jud na. Then katong mag-assist ka sa lighting. So, tulo for management. And sa risk factors kay traumatic nga birth delivery, inadequate episiotomy, sa dili saktong pag-episiotomy, kulangan, and macrosomia. So, cervical lacerations, we also have cervix nga laceration. Ito na ang pinaka-end sa vagina. Nandira ni mo siya ilang kung pila ka dilation. So, ang cervical laceration na to is very difficult to repair. And nursing response because rugged lagi siya. So, kailangan ng proper lighting. So, lacerations, we have perineal 4 degrees due to lithotomy. Cervical, mapil if fundal push. Cervical laceration, mag fundal push ka, more likely ma-apil jud na siya. And vaginal, easier to access but harder to repair. Muna siya sa episiotomy. Harder to repair, corrugated ang kuan. So, lahi ang perineal sa kasi pasabot sa perineal. Abel na siya sa abdomen. Perineum. Whole vaginal na ata na. Yeah. So, due to lithotomy position, no, ang perineal, vaginal is easier to access but harder to repair because vagina is erogated. So, we also have hematomas, guys. So, ang hematoma is a blood vessel that ruptures and leaks into the surrounding tissues. Hematoma is a blood vessels that ruptures and leaks into the surrounding tissue. So manifestation niya is pain, pressure, pain, and swelling, dark red purple discoloration, firm to touch, and tender on palpation. So what is hematoma? It is a ruptured vessel that surrounds the tissues. Ruptured vessel ruptures and leaks into surrounding tissues. Malik siya sa surrounding tissue. So, manifestation is bleeding, pressure, pain, and swelling. Pressure, pain, and swelling. And dark red and purple ang color. Pressure, sa tong small trickle of blood. Sa tong small trickle of blood. So, laceration to na part, small trickle of blood. Laceration to na part, yun. Basta. Balikan na to niya. So, kani siya kay dark red and purple. Ang imong makolor sa kani man gud siya, kani. Dayon, magka-cause siya tissue, tender on palpation. So, you will feel tenderness upon palpation. Tender, ang imong pagpalpate niya kay sakit. And also, we also would have firm to touch. So, pag-touch niyo mo siya kay, kanang parehas bito sa kuwang kay firm siya. So, you will know, hematoma. We also have pelvic hematoma. So, sa lacerations, we have 3, the pelvic, the vaginal, ug the cervical. So, sa vaginal, nga, kuan kay difficult siya repair. So, sa pelvic hematoma, we have, mana siya hematoma, manifestation niya is pressure, pain, swelling, and blue and purple discoloration, and, no, not red and purple discoloration, tenderness on palpation, and firm to touch. So, pelvic hematoma, guys, is we have more difficulty to identify. Primary symptom is deep pain. So, pelvic hematoma, ang primary symptom nato niya is deep pain. Mas difficult siya i-identify po ang pelvic hematoma. So, difficult i-identify ang vagina sa lacerations. Ang pelvic hematoma mo, difficult to identify. So, risk factors na to siya kay inadequate suturing, macrosomia, vulvar varicosities. So, how do we manage kanina na dari mga gawas, guys. So, how do we manage hematomas? So, for small hematomas, we provide ice compress. So, cold first, and then the first 24 hours na din ato is hot after increased circulation. So, analgesics absorb spontaneously in 4 to 6 weeks. Okay, so management nato sa small hematomas is analgesics, hot, cold una, then hot after to increase circulation. So, sani, ice packs, ice compress. So, katong sa uterine ato ni kay mag ice packs ta, then kani sa hematomas na small lang is mag ice compress. So, sa increase cold una kay to promote vasoconstriction. So, cold una for the first 24 hours. Then, after 24 hours, pwede na ka maglagay ng hot compress to increase circulation. So, large hematomas is may rupture and cause severe infection and bleeding. So, hematomas no kay buto siya, guys. Buto siya. Like, buto siya, guys. And for management nato niya, so kani siya absorb spontaneously in 4 to 6 weeks. Ang small hematomas, guys, kay mo absorbs spontaneously in 4 to 6 weeks. I don't know kung sa pasabot ana. Pero ang surgical incision with drainage and evacuation of clots. So may rupture and cause severe bleeding and infection ang large hematomas. Then ang surgical kailangan siya surgical incision. So, kailangan nimo siya surgical incision with drainage and evacuation of clots. So, kailangan dyan nimo siya. So, ang large hematomas, guys, kailangan nimo siya surgical incision with drainage. So, ang large hematomas, kay i-incise dyan nimo siya, i-cut dyan nimo siya, dayan drainage. So, muna ilang giingon pod. May rupture and cause severe infection. So, ang uban kay maglagation of the bleeding vessels, antibiotics, blood transfusion kay kuan. So unsay cause hematomas guys ay inadequate ang pag-suture. So that's why mag-rupture ang blood vessels, musuran siya sa surrounding tissues. So dili enough ang pagtahi guys. Now we will move on to late retained placental fragments. So ang kaning tanan day guys kay postpartum complications sa hemorrhage. So natay uterine atony sa early we have uli. So uterine atony ang una, then mato sa lacerations and hematomas, then inversion of the uterus sa early causes. Dayon for the mag-start na ta sa retained placental fragments, late postpartum hemorrhage na ni siya. So late postpartum hemorrhage kay retained placental fragments, infection, and subinvolution of the uterus. So sa large hematomas again is imo siyang i-incise and then i-resuture again. So muna for large hematomas. While for small hematomas, we provide ice compress. So ice for 24 hours. So mag-move on na ta sa retained placental fragments. So retained placental fragments kay i-check na to ang completeness of the placenta. So kung previous uterine surgery, because mapilit ang retained placenta sa scar tissues. So magkakos siya scarring guys. So risk factors niya is assess, kailangan natin i-assess ang complete loss sa kuan because mapilit ang retained placental fragments sa scar tissue kay kanang mga previous uterine surgery kay risk factor siya sa kuan kay dira mo pilit ang mga tissues. So we also have succinturate placenta kanang accessory lobe ang placenta kay naay accessory lobe kay naay pakapin. So possible mabili ng pakapin guys. And ang akrita kay deep kaayo ang attachment to the myometrium. So kung deep kayong attachment sa myometrium, maunsa naman ron? Deep kayo mong attachment, deep ra kayo mong attachment sa myometrium. Palayo sa daube, no? So muna siya kuan siya is surgical ni siya og incise. So muna siya ang normal decidua, ang akrita kay nato na jud siya sa myometrium oh. Kana ara ba ang pag-attach niya kani kay sobraan na jud kay siya. Dayon ang kaning kuan pod kay na ay sobrang krita. So small retained placental fragments detected on the 6th to 10th day. And large retained placental fragments kay ma-detect na to siya immediately after delivery for uterine atony. So sudden onset of bleeding, uterus is not contracted firmly. So ma-feel man na nimo. So muna yung naka-ingon ko nga mo increase ang HCG levels on ultrasound. If positive ang patient for placental fragments, mo increase iyahang HCG levels on ultrasound. Kay mo man ay purpose sa HCG, di ba? If naisulod imong uterus, pataas imong HCG, di mo kasi vomiting. So management is guan na to siya, dilatation and curettage if necessary. So dilation and curettage na to siya guys. Ngano man, para makita na to siya, ang i-dilate sa nato una din i-curate dayon nato kung unsa atong makuha dira. So naputoy oxytoxic. So ang giingon diri management nato kay oxytoxic sa katunaning gamay ra nga mga small lang good na placental fragments ang naa. So katong ma-detect na to siya sa 6 to 10 days, and if daghan na ang large placental fragments na, we proceed with dilatation and curettage. Daghan, if many kayo. Dili large, but daghan, many. If konti lang, we provide oxytocin. So, promote contraction, expel ang fragments. So, we have here sub-involution of the uterus. So, mo return ang involution is the return of the uterus to its pre-pregnancy stage. Mubalik complete ni ang hinay-hinay. Pero ngano may munay involution. Pero gibot nga nato siya sub munang hinay ang pasabot sa sub. So I will question you, is sub-involution large or early or late postpartum hemorrhage? Late postpartum hemorrhage kay na siya sa risk. So retain placental fragments, infection, and sub-involution. So wala infection diri na part, pero sige na lang. So sub-involution of the uterus, okay, klaro naman siya, no need to start. So diri na lang, the uterus is to expatiate na lower rate. Usually ang normal rate is 1 finger breath for 1 centimeters or 1 finger breath per day. Pero karon hinay kayo siya, pila na lang man iyang rate. So, ang causes niya guys is retained placental fragments and infection. So, basta naka-retain placental fragments, magka-cause ka og sub-involution. And also, infection. So, nadari ang infection guys sa risk. Signs and symptoms: heavier imong lochia, imong intermittent imong bleeding. So sa lochia kay we have rubra, serosa, and alba. So 1 to 3 days, 4 to 9 days, and 10 days ang serosa. Ang serosa 4 to 9, alba is 10 days. So intermittent imong bleeding, so dili stops bleeding, stop. Then fall smelling imong discharge. Pelvic pain and heaviness. So, ang pelvic pain, apo na siya sa peritonitis, no? So, how do we treat the cause? We provide oxytoxic or methergine. Ano man? For retained placental fragments. Anong mag-provide ka og oxytoxic sa... mag-provide ka og oxytoxic sa kuan? Muna siya for retained placental fragments. Mag-oxytoxic ta sa sub-involution of the uterus. Sub-involution of the uterus, how do we treat that? Oxytoxic. So, we also have antepartum risk for factors. So, pregnancy, before pregnancy, antepartum. Before pa. Intra, labor and delivery na ka. So, how at risk for infection na ba ni or sub-involution gihapon? So, I feel like infection na ni siya. Mo siya na pinaka kuan og CS infection pud nga causing sa imong perineum. And urinary catheterization guys, kato pa yung ibalik-balik, ipasa-pasa ang catheter sa mga between sa mama, kaluoy, gamito ni mong utro ang catheter sa different nga kiki, that's so infection causing. So, postpartum infection, also known as puerperal infection. So, episiotomy, lacerations, makakause pod og infection, traumatic birth, prolonged rupture of membranes, poor aseptic technique. So, endometritis na ta guys, infection of the endometrium. So, muna siya ang innermost lining of the uterus. So, I guess muna po niya siya ang sa infection. So, we have 3 kinds of infection. Sa endometritis, sa ang endometritis sa pinaka inner lining of the uterus. Diba? Yeah. So, ang fornix, ang itong sa vagina, ang pinaka-mark sa fundus na part. So, pinakataas ba? So, we have, wound infection is divided into sa perineal, sa kiki, and also sa CS, post-incisional. So, muna giingon ni Sophia Grace. We also have peritonitis sa sa peritoneal cavity. So, katong endometritis mo promote na siya to peritonitis. And in mastitis is sa infection siya sa breast. So, we'll continue. Endometritis, infection of the endometrium. Magkakos siya malaise or ano na, general na siya nga fatigue ang malaise. Dayon. Fever, chills, and uterine subinvolution tenderness. Munay, say signs and symptoms sa endometritis, katong malaise, kay fever and chills, kay dehydrated ang patient, and subinvolution, uterine tenderness, and lochia is increased. If dehydrated, mo grabe pa jud sa mutang infection. Then we can diagnose this through increased ang white blood count and ultrasound. So, pila day ang normal na white blood count? Comment down below. So, ultrasound po. So, if febrile, lochia may be scant or absent. So, nag-init ang patient, pwede pagkawalay lochia, ana. So, how do we manage it? How do we manage sa endometritis? So, mag-give tag oral fluids kay dehydrated man gud ang patient ani. So, muna po din gingon ni Pia nga dehydrated ang patient. Then, mag-give tag antibiotics, oxytocin to expel infected na lochia, contract and expel. So, analgesics po, mag-provide po tag analgesics. So, itong pain relievers ni siya kay sakit ba mag-contract. So, and lastly, if lesions kay infected ang lochia, expelled through gravity, so such as walking. So, ang tanong number 5. Ako nang gisulat kahabi eh. Semi-Fowler's position. So, timan jud guys na sa endometritis, mag semi-Fowler's position ta para dili bitaw ang lochia mo i-expel na nimo siya through gravity. Kay again, what are the signs and symptoms of endometritis? Na kay foul smelling na lochia nga increase pa jud siya. Ang pinaka signs and symptoms jud sa kwan kay increase ang imong lochia sa endometritis. So, semi-Fowler's na to siya kay kung mahigda, possible mo daghan, dili mo gamay, or possible dili siya mo mobos ang quantities kay gravity man gud ang makapawala ana guys. So, wound infection, we have postpartum wound infection and post-operation wound infection. So, sa perineal and sa CS. So, sa perineal wound infection, we have mo develop ni siya 3rd to 4th day postpartum, and factors increasing risk of infected lochia and fecal contamination, poor hygiene. So, sensitivity niya, poor hygiene. 3rd to 4th postpartum day pa ang perineal wound infection. So, sensitivity, blood edges, false smell, purulent ang drainage, pain, redness, edema of the surrounding tissue. So, management is cefixime and warm sitz baths 20 minutes for several days. So, warm compress, analgesics, and antibiotics. So, we also have post-operational or incisional. So, 4th day. So, 3rd to 4th ba to? third to 4th and kanijud kay sa 4th day pa siya mo usually og gawas. So after endometritis, post in CS, after endometritis, no? So if tama post incisional unsa diba kay ang endometritis mag-lead pud siya sa kuan peritonitis. So different ang post incisional nga CS o kuan ha endometritis. Okay, so next is ang treatment for post-incisional. Munang mag-debridement and suturing. Unsay pasabot sa debridement? Wala ko kasabot unsay pasabot meaning sa debridement. So comment down below pud na siya. Important nimo siya. So febrile, ang unsay signs and symptoms sa post-incisional. So we have sa perineal, ang signs and symptoms is increase ang imong lochia. Dili sa kuanto ang increased lochia sa endometritis, pero sa wound infection ma-infected ang lochia, magka-cause kag fetal dili factors man na. Signs and symptoms niya is separation of wound edges, foul smelling lagi ang purulent TNH. Pero signs and symptoms sa post CS kay we have wound edges may separate. So haluoy kaayo ang mamano kay diba ang after CS kay naman jud na wounds, so it may separate. Like that's so worse. That's very worse. Oh, so we have peritonitis, usually an extension of endometrium. So again. So ang wound niya kay ang wound niya kay mo tangtang, and ang atoang way to manage that is debridement and suturing. Okay. So usually an extension of endometritis ang peritonitis. So signs and symptoms niya guys, rigid abdomen, abdominal pain, guarding and increased fever and vomiting. Rigid ang abdomen, peritonitis yun na siya. And so mag NGT insertion ta, mag IV fluid, mag large doses of antibiotics, mag cause infertility. So mastitis. So ang post-incisional ay ang hindi naman ay post-incisional. Kuan naman ni katong mag IV insertion ta kay peritonitis, mag IV insertion ta sa peritonitis, peritoneal cavity, peritonitis is an extension of endometritis. So sa mastitis kay breastfeeding for the first time, dili kabalo ang mama unsaon pagkuan guys, di siya kabalo unsaon pagpatutoy paglatch baby. So inflammation of the breast and mammary gland due to milk status. So natay redness and swelling on one breast, intense pain on the affected side. So kung engorgement siya kay generalized ang discomfort, pero dini kay na ay fever and flu-like symptoms. So caused by blocked milk or milk stasis or bacterial infection due to ang baby's mouth containing bacteria. So engorgement kay called mictas, crack or bleeding nipple. Signs and symptoms niya is flu-like symptoms, breast tenderness. So treatment nato niya kay antibiotics. We also need to begin breastfeeding on where? Sa affected na breast. So to prevent further milk stasis, i-breastfeed na to siya 1 and 30 minutes to 2 hours. So express pump breast milk, warm compress shower before breastfeeding. So, we also have urinary tract infection. Urinary tract infection, say, naaani niya. Wala kaayo. So, urinary tract infection kay natay cystitis ug pyelonephritis. So, yung urinary bladder, sa urinary bladder ni siya, pain and hypogastric. So, ang munang cystitis, then ang pyelonephritis kay sa kidneys nanukausin siya o flank pain. So, ang cystitis kay sa urinary bladder basta cyst, mautong cystosil, and pain niya kaysa hypogastric. So, causes niya ay short imong urethra, trauma to the bladder, urinary retention, overdistension, and catheterization, frequent vaginal exams. So, muna yung makakausa sa UTI, nasamad na ay dugo, RBC, nasamad, magnana, kay pus na siya nga cell. Poke, jab, poke. Urine trauma to the bladder during delivery, urinary retention, overdistension. So, ito yung makakausa sa overdistension. So, for pyelonephritis, apil po ang causes niya is sa cystitis siguro ni low-grade fever, suprapubic vein, urinary urgency, urination of the oliguria. Basta cyst again is sa urinary bladder. So, basta pyelonephritis, magawas tayo nga flank pain siya. So, nausea and vomiting, fever with shaking, chills, flank pain. So, antibiotics management, antispasmodic, antiemetics, hydration, 3,000 cc, good perineal hygiene, sakwa daw na siya. So, superficial thrombophlebitis is katong dili siya mo dislodge. So, increased imong clotting factors, dilatation of veins in the lower extremities, venous pooling. So, muna yung mga risk factors, may increased imong clotting factors, dilatation of veins. So, modilate ang mga veins. So, kung klaro na kayo siya guys, and venous pooling and stasis in the pelvic area during labor and delivery. So, superficial. The clot is attached firmly to the vein wall and does not loose easily. So, attached na dyan kay siya. So, okay ra siya guys. Hindi siya okay. Kay bad yapon siya. Inflammation of the lining of the vein with formation of clots. Pero, sa superficial magudi siya possible nga makakause og embolism kay ang deep vein thrombosis ray makakause ana kay mo travel manggod siya. So, the clot may break free during muscular movement and travel in the circulation. Kani siya kay the clot is attached firmly to the vein ang superficial and does not loose easily. So, deep vein thrombosis, matravel siya sa circulation. So, according to location ni siya nga characteristics sa thromboembolism disorders ni siya. So, if we have types according to the veins affected, we have the femoral thrombophlebitis, involves the veins of the leg. So, dirata magka-human sign or calf pain when the foot is dorsiflex. Also called sa human sign, milk leg phlegmatia alba dolens. Maputi ang leg because of swelling, kalooy ba ana oy. Puti ka, like, gusto ka maputi, pero maputi po ka, due to swelling, ganyan na lang, ay na lang. So, mga siya, femoral thrombophlebitis. So, we also have pelvic thrombophlebitis sa ovarian, uterine, and pelvic veins. So, manifestation na to niya is fever, high fever and shade, and body malaise. So, napatoy other nga body malaise. So, sa management is, management, we focus of care na to jud sa thrombophlebitis is natay sa location naputay sa veins, diba? So, sa location is katong location katong sa deep vein o sa superficial vein. Basta sa veins kay we have the femoral o the pelvic raw eh. Dayon sa focus of care nato generally anemia is to prevent further thrombus formation and pulmonary embolism. So kana sila atong ipa-bed rest with the affected leg elevated. So hot compress ta guys if superficial. Ano man. Superficial lang. Wala man diri giingon kung ano unsay mong management. So hot compress ta sa superficial lang. Ayan. Superficial raman ni ang kani nga management. So, how do we manage? First, ta sa superficial, ma-provide tag analgesics, bed rest with affected leg, and provide ta og kaning star ice compress, hot compress. Kada sa ta mag-ice compress, kada sa uterine ato ni og sa lacerations pa to. Itong isa nga mag-hot compress ta. Kalimot na. Comment down below. So, hot compress ta sa superficial thromboembolism. So, management na to guys. Excess ako kay kalingi. Okay ko. Continuation after man ako libang. Is that necessary? Yeah. So, management na to guys for superficial vein thromboembolism is we hot compress para mo dilate ang blood vessels and ma-avoid tag massaging in the area kaya mo resolve na ni siya without anticoagulants. Dayon, for deep vein thrombosis, treatment is similar to superficial vein. So mag-add tag analgesics, pain reliever, bed rest with the affected leg elevated, and the mag hot compress ta, mag-avoid tag massaging sa area, pero ang additional mag-add ta og heparin. So muna siya ang anticoagulant na gingon sa superficial vein nga dili na siya necessary mag-add. Then change to PO until approximately 6 weeks. Say PO. Oral na siya. Oral. So, same with anaphylactic syndrome of pregnancy nga pulmonary embolism nga dangerous siya. Kay, naay mga, kuan bitaw ka ng, naay, kuan ba, like, fragments nga muadto sa imuhang, muadto sa imuhang lungs. So, signs and symptoms niya kay sudden sharp pain, tachypnea, tachycardia, orthopnea, cyanosis, hypotension, hemoptysis. So, what is the first management? Dili na nato siya i-resuscitate. First management din nato is oxygen inhalation by face mask. It could be also be treated with dopamine for hypotension. Dopamine ang kuanana. So, levodopa pud no kay sa dopamine po di ang kulang, pero it's also hypotension. It's also something similar to hypotension. Si Lola kay na siya Parkinson, so gamay siya dopamine, tapos nag-hypotension pa dyan siya, so dito na dyan na siya i-hospital. So heparin prevent blood clot formation, thrombolytic agents to dissolve existing clot. So ICU monitoring until clot adheres to the arterial wall and absorb. So, mas dangerous jud daw ang hypotension kaysa sa hypertension. Okay, lisod kayo ipasaka daw ang BP kaysa sa ipaubos. So, postpartum psychiatric disorders, we have mananat ta sa almost oxygen inhalation for hypotension, heparin to prevent formation, blood agents to dissolve the anticoagulants, thrombolytic agents din. So may example sa thrombolytic agents to dissolve, to prevent formation. So postpartum blues, kano sa siya mag-last 2 to 3 days lang. Baby blues or maternity blues, temporary depression sa 3rd day. 2 to 3 days lang siya mag-last. Dili hatagon ng panyo or patang bakay, mahilak ang mamag sa mutana. Tearful, difficult sleeping, eating, feels generally down. So postpartum depression 1 to 12 months after delivery, possible etiology, previous depression, hormonal response, and lack of social support. So, kailangan jud sa phobia na event, kailangan jud na support ang mama. So, like, as a nurse, you could congratulate the mother, you know. So, manifestation, extreme sadness or irritability, lack of interest, pleasure in usual activities. So, perception of reality remains intact naman sa depression. Pero, sa psychosis, dira na ka magka-hallucinations, delusions or hallucinations to harm the infant or cells na nakay false perception of reality within the first month of postpartum. So, risk na ka for suicide and infanticide. So, how do we manage this? Psychotherapy, drug therapy, antipsychotics, antidepressants, suicide precautions. So, suicide precaution examples na to, remove na to mga sharps, remove rope, or pwede mahikot, separate baby from the mother. So, ayaw jud pagka nanakay delusions or hallucinations that lead to harm to the self or the baby. Nanata sa disorders of sexual functioning, also known as sexual dysfunction. So, primary, lifelong condition, impotent jud ka since birth. And secondary, occurs after the person experience normal functioning situation. No? So, normal functioning na ka sa una. Pero so, female dysfunction first. Disturbance of one or more of the phases of human sexual response. So, ang mga phases sa sexual response kay desire, excitement, arousal, orgasm, and resolution. So, kung mag-masturbate, pwede ang ma-feel. Maybe biological, excitement plateau, orgasm, resolution. Maybe biological or psychological or social or in nature combination. So, hypoactive, naglibog sila ang slide kung mo ba niyang gi-answer, pero mo dyan ang answer, hypoactive. Persistent deficiency man or absence of sexual desire, kaya di siya gangahan mag-jur. Causes, gikapoy daw ingon si Terence. So, mali. Meds affecting sexual dysfunction. CNS, depressants, narcotics, anti-anxiety, barbiturates, benzodiazepines, anticholinergic agents, atropine, cardiovascular, antiarrhythmics, antihypertensive, diuretics, beta blockers, antidepressants, and antipsychotics, social drugs, alcohol, and marijuana. Common physical causes, use of medications, so mo ni siya, mga antidepressants, antipsychotics, social drugs, depression, chronic illness, chronic disease, pregnancy, lactation, menopause. So, vaginal dryness na siya. So, muna causes of hypoactive. Kung nakay depression, hypoactive jud ka. Chronic disease, hypoactive jud ka. Kaya marami kang depressed, pregnancy, especially during the first trimester because of breast tenderness. Ayaw sa ko jujera kay, kay, ibuntis na gali ko mo. So, lactation and menopause. So, we are here with the psychological factors, relationship problems, perceived loss of personal attractiveness. So, feeling nimo dili ka beautiful. So, dili ka gangahan mag-jur. So, sexual aversion, persistent avoidance, dili jud ka kay na kato ni si Ayana kay common in naman ko siya abuse, guys. So overt na siya, so ipangutaran nimo na kay abuse, ma'am, wala. So hypoactive day ka, ma'am. So pain disorders is vaginismus, painful or involuntary spasm of the muscles surrounding the vagina that can impede penetration. Agay, painful ang imong spasm. So like mura kag nagkuan ba, painful spasm means kanang painful bitaw nga seizure, something like that, surrounding the vagina that can impede penetration. So vaginal lock in John Lloyd, si John Lloyd o si Shaina daw kay nag-vaginal lock. That's so crazy. I feel like money reason nga wala na si Shaina kaayo karon kay nag-vaginal lock tis la kaulaw so muscle contraction may impede the removal of the penis. So ang vagina mo isalaan ni, guys, kay nag-vaginismo siya. So may causes ana niya. Psychological causes kay fear of pain during sex or fear of pregnancy, trauma, negative belief, or relationship issue. So kung naamoy beef din mag-jer mo, ayaw sa jud mo pag-jer kay like mag-vaginismus ka. No! If naka-fear pod mag-jer, magkakaos kag vaginismus if imuhang padayon na imong gibati, like no. So remain calm, do not force separation, use deep breathing, wait for relaxation. So contract muna siya. We also have dyspareunia, where painful intercourse, endometritis, mga infection guys, hormonal changes, psychological, negative attitude towards sexuality, relationship conflict, sexual abuse, or orgasmic disorders, delayed ang imong orgasm. Kanas experience orgasm kaluoy. So, dry kay ni siya. Psychological, difficult concentration, poor sexual technique, antidepressants. Psychological, poor depressant. So, how do we manage man sa kuan? Can I start it guys? How do we manage sa postpartum? How do we manage aversion? I mean, kung naman ni. How do we manage pain problems? Vaginismus. So, how do we manage vaginismus? So, remain calm, do not force separation, use deep breathing, wait for relaxation. Nato yung giingon si Shay na wala niya gi all of the above. Then, sakto siya kay wala niya gi all of the above. Dapat dili dito siya all of the above. So, sa kaya to. Kalimut ko. Dyspareunia. Painful sexual intercourse. So, male sexual dysfunction. Impotence. Inability to produce or maintain erection for long enough for vaginal penetration. Saan ang vaginal